It's been 2 years since the World Health Organization declared COVID-19 a pandemic. And like most viruses, it continues to mutate into different transmissible variants. But the question remains, where are we now in the battle against COVID-19? In this episode, we'll review where the herd immunity threshold is and which gaps we still have to fill as we enter year 3 of the coronavirus pandemic. I'm Dr. Freddy Gomez and welcome to MedTalk Health Talk on CNN Philippines. Our guests are here today to give insights on the current state of the COVID-19 pandemic. With us is Dr. Ronjin Solante, who is the head of the Infectious Diseases and Tropical Medicine Department of San Lazaro Hospital and member of the Vaccine Expert Panel. We're also joined by Dr. Mark Edsel Ayes. He's the Clinical Genomics Laboratory Head at the Philippine Genome Center. Now, recent figures show that the Philippines is back to low risk for COVID-19. I'll start the discussion with Dr. Edsel. Do you think the country is out of danger? And if so, to which should we attribute the drop in infections?
The number of active cases has been going down. And as we have seen over the course of the pandemic, which has been nearly 2 years, is that there has been a cyclic occurrence of cases. So there will be surges and then they will go back down again. But just to reiterate, in the context of the pandemic, the WHO has not yet declared that the pandemic has ended. There are still active infections going around the world. And as such, the possibility of another surge occurring due to another variant that can come about as a result of all of these active infections is still possible.
Now, Dr. Jean, when it comes to that, people are getting really excited, really can't wait for all of this to end, but yet there are still some infections going about. Some people are still being sick with COVID-19, even though they are already vaccinated and boosted as well. What could be an explanation for this, Dr. Jean?
We know that over the past months, the virus has mutated, and that mutation also affected the ability of their vaccine to produce those antibodies to the point that it was able to evade the antibodies produced by our immune system. And precisely, that's what we're talking about, that there will still be infection, there will still be transmission, but with vaccination, the risk of getting the more severe form, getting to be hospitalized, will be manageable precisely as we move on with this pandemic, since the vaccine are not virus blocking. There's still a possibility that transmission can occur, and that's why we are really emphasizing the importance of vaccination, particularly the booster dose of the vulnerable population.
Dr. Jean, earlier in the pandemic, there was a lot of focus on the number of cases. How many new cases do we have? Is this still a figure that Filipinos should be concerned about, or should they focus on these figures, or how many people are dying if the hospitals are being filled?
The experience we have for several months, and especially for the 2 to 3 waves of surge of cases that we have, I think it's now important that it's not really monitoring the number of cases every day. The most important part now is monitoring the healthcare utilization, looking at patients, if they have COVID, are admitted, did they develop severe infection? Because these are the more important metrics in terms of preparation and in terms of more strict implementation of an alert level, rather than just counting cases where most of these cases are mild, and in fact, a lot of them are really asymptomatic.
The health department also said that the healthcare utilization rates in the country and most of its regions were at low risk, and that only the intensive care unit occupancy of the Davao region remains at moderate risk. Dr. Jean, what does this mean for our country?
This virus is manageable. The number of cases are manageable, and we can now focus on other conditions or other infectious diseases that has suffered in terms of the increases in cases during the pandemic. And I would like to give examples like tuberculosis and HIV. For the past 2 years, there is really a significant increase of these cases because most of those patients who have this infection are not going to the hospital because of fear of COVID-19. So it's good that our healthcare utilization is going down so that we can take care of other infectious diseases aside from COVID-19.
Last January 2022, there was a record-breaking surge in infections following the detection of the hyper-contagious Omicron variant. Now, though, a new variant has emerged, the BA.2. Dr. Edsel, here we go again. Another variant is coming up. What can you tell us about this new BA.2? Is this something that we should be worried about, something that we should be concerned?
From the current studies going on, they show that BA2, or the subvariant of Omicron, is only slightly more infectious than Omicron, but has no difference in terms of the severity, at least from what current reports are suggesting.
Now, another catchphrase, of course, lately is the term endemic. So we hear a lot of terms come about that instead of the COVID-19 becoming in a pandemic situation, it will become endemic. Dr. Jean, what does endemic mean?
Just to give example of endemic infections in the country, we have dengue, we have leptospirosis, even typhoid fever. So what the commonality among these cases? These are cases year-round, but not enough to disrupt our life, not enough to cause lockdowns. And at the same time, we still maintain to treat them as something that to prevent complications. So that's what we are hoping, that this virus will be just endemic and it will not also disrupt the healthcare utilization rate in our country.
In line with that, Dr. Jean, there's also a trend nowadays with other countries, Western countries, of already taking away the mask protocol that they have. People are now walking around without masks. Now, I have to include there that the mask issue in other countries is much more politicized than it is here. But Dr. Jean, in a purely scientific sense, can the Filipinos sort of see in the foreseeable future that they will no longer be needing to wear masks?
Yes, that's a possibility, and that will depend on the number of cases in the community. As long as there will be no more higher community transmission, I think that will eventually come. No? But at this point in time, since we don't know yet the behavior of this Omicron variant, we're still seeing cases every day. It's not safe to take out our mask. And that's the most important protection as we go out from our home, we go to our workplaces, protecting us from being exposed to possible source of an infection.
Yes, so the best way pa rin is to follow the basic health protocol. So wear your mask, practice proper hand washing, and of course, physical distancing. Now, COVID-19 is becoming endemic does not mean that we've seen the last days of the virus. But the hope is that enough people gain immune protection from vaccination or natural infection. When we return, we look into how far we've gone in vaccination and treatment for COVID-19. We'll be right back here on Med Talk Health Talk. I'm Dr. Freddy Gomez, and welcome back to Med Talk Health Talk, where caring is our calling. According to Reuters COVID-19 tracker, the Philippines has vaccinated more than half of its 110 million population. Booster shots have also been made available for the general population. And most recently, the mass vaccination rollout includes children aged 5 to 11. Now, one issue that parents may have is getting their kids to take their first vaccination shots. Dr. Jean, do you have tips for parents and maybe their guardians on how to prepare their child for their COVID-19 vaccination?
When you are vaccinated, you are protected against severe infections, especially children. These vaccines have been proven to be safe. And when you say safe, the risk of long-term adverse event is very rare. The protection it gets from this vaccine, especially when they will be going face-to-face classes, will be very important for them as we move on with this pandemic. And if they have comorbidities, if the children have comorbidities, they need to get a certificate from their doctors that they are stable to be given the COVID-19 vaccines.
Now, children have been particularly affected by the COVID-19 pandemic as most schools have remained closed for 2 years and counting. Now, Dr. Jean, what do you think about fully vaccinated grade schoolers returning to face-to-face classes? Is this doable? Is the vaccine enough of a safety net for parents especially?
Yes, of course. That's what we want to do now, and that's what we want to emphasize, the importance of vaccination. that when they will be going face to face, then they have ample protection. Of course, aside from wearing the face mask, and ventilation in the school should also be part of that, the environmental control. But for me, the individual protection with vaccination, even if you get the infection, it can just be mild, but specifically for children being exposed and going to for a face-to-face classes, the risk is really very high because they will now be going from their house, transportation, and then to the school, and then back to the house. That's just enormous risk of exposure, and that's why we want, Freddie, we want to really build that wall of immunity, not only for adults, but everyone that is eligible for the vaccination. And that's why the government is really ramping up vaccination before we can adapt to this new normal, and everybody will be ready. If in case there will be new variants of concern or new surge of cases, that wall of immunity will be there for us to protect us.
Now let's talk about another group of people at risk. And these are people with comorbidities. Because recent data from the Centers for Disease Control and Prevention, or CDC, noted that protection offered by COVID-19 boosters against severe disease dropped after just 4 months. And this raises the possibility that a fourth shot may be needed for high-risk groups like the elderly and people with comorbidities. Some people, not just one, but multiple comorbidities. Dr. Edsel, can you explain why a possible fourth shot might be needed and how this should be in the minds of people?
Of course, this is really part of the virus side of the equation. Now, how well the virus is able to adapt and eventually evade our immunity in terms of being neutralized, or not getting infected. And this is something that's going to be actively pursued and checked by the health bodies, because again, people with comorbidities, as we've repeated, is that if you do get infected, the risk for severe is very high. So it's important that they are given the necessary protection to prevent that from happening.
Now, Dr. Jean, when it comes to people with comorbidities, is there a definite risk still nowadays? Are these the people we see with symptoms that need hospital care?
Yes, correct, Freddie. Why is that so? Because if you are in a vulnerable population, you have comorbidities. And when you have COVID, that infection will make your comorbidities unstable. Like, for example, if you have hypertension and if you get COVID, it may not be the respiratory symptoms, but because of the infection, your blood pressure goes up. And that's why we're seeing a lot of these patients now incidentally positive for COVID, but they present in the hospital because of stroke, because of bleeding in the brain and paralysis. So that's just important. The importance of vaccination is really emphasized, because when we look at comorbidities and vulnerable population, Freddie, the bar of protection, the bar of efficacy of a vaccine should be higher compared to the younger population. On that manner, as Dr. Edsel mentioned, this is where we can maximize the importance of giving, if I may say, giving a fourth dose, the booster dose.
Dr. Jean, when it comes to their fear of having their checkup, because a lot of people with comorbidities probably have not had their regular checkup in at least 2 years or so because of fear of being infected. What is your advice for them in terms of hospitals now being safe for people with comorbid conditions?
Okay, so they should not be fearful about the situation now, compared to several months ago. We are a better, safer place now compared to previous months. More people are already vaccinated. And at the same time, the hospital has always been ready in accommodating patients, especially with regards to an environment that there will be less transmission. And that's where you have the face mask, the face shield, and a good ventilation. So I would really encourage them to go back and have your checkup, regular checkup with your doctors, and maintain your maintenance medication, and to prevent also infection, have yourself vaccinated.
Now, Dr. Edsel, I'd like to touch on now about testing. What's your advice for the viewers when it comes to testing? Is RT-PCR still the gold standard? Should people be testing themselves at random every now and then just to be sure for their peace of mind? What's your advice?
Again, what we have to remind people is these are risk mitigation strategies. No, you don't have to do it, but it is recommended if you do. And there are certain ways that we can do it that can approach it by reducing the risk strategies. So what I'm trying to say is there is no single correct way to do it, but depending on how you approach it, the goal is really to reduce the risk of infection to staff, to personnel, or anyone in a certain situation. But if it's a question of the gold standard, no, the gold standard will still be RT-PCR testing. And we can utilize the many tools that at our disposal, again, to reduce the risk. So that yun yung goal naman talaga ng testing.
Now, while treating mild COVID-19 symptoms can be managed at home, what about for people who aren't infected? Can we start going back to normal? More on this after a short break. You're watching Med Talk Health Talk, where your care always comes first. I'm Dr. Freddy Gomez, and welcome back to Med Talk Health Talk, your partner in healthcare. Dining out in open spaces, watching movies 1 seat apart inside theaters, and traveling for leisure. These are some new normal activities we've developed over the last 2 years. Yet our health should still take priority. A number of us might be struggling with the so-called pandemic weight. Stagnation also negatively affects our mental health. So, if our viewers want to go to the gym or bike around the metro, Dr. Jean, how do they protect themselves from COVID? What are some reminders? People who like to go outdoors and feel that it's enough ventilation to not wear any mask or things that might protect them from the virus. Is this sound advice?
Still, we have to be very careful with the way we deal with this virus. For one, always wear your face mask. Second, frequent hand washing. Third, do regular disinfection. If you are in an environment like gym, do regular disinfection before you go to another area. And as much as possible, especially in enclosed spaces, the gym, the restaurant, you have to ensure also a very good ventilation. And I think those are important aspects of the prevention and what is this new normal.
Now, the World Health Organization said last February 12 that the decreasing trend in the country's COVID-19 cases was really encouraging. Now, as we move into another year of the COVID-19 pandemic, we are more aware and equipped with the knowledge in beating the virus. Dr. Edsel, what should Filipinos look forward to in the coming months?
Most of the same right now, no? So nakasanayan ninyo until it's officially announced by the WHO that the pandemic is over. I would suggest that people maintain their vigilance, no? Wear your face masks, no? As Dr. Solante said, no? Hygiene, no? And regular disinfection, ventilation in the areas, no? So I'd like people to take the idea that the possibility that something like this might occur in the future. And hopefully we have learned from the COVID-19 pandemic so that we're a bit more prepared kung sakali mangyari man lang ang ganitong situation ulit.
Now, Dr. Jean, if there's something that this pandemic, a good thing that this pandemic brought about is that a lot of people have been more health conscious, especially their awareness on trying to be aware that something can infect them, as Dr. Edsel mentioned. If there's something that people should continue to still adopt within their daily routine in terms of infection control, even past this pandemic, what should they be, Dr. Jean?
We have to change our mindset. By changing our mindset and being very careful, then that will also dictate our behavior. So, meaning we have to protect ourselves every day. Even if we go back to normal, we want to go back to our life, but there's still that important protection that we should not be complacent about. So I think that's the basic approach now of most Filipinos. And of course, Freddy, vaccinations, I would still like to emphasize the importance of vaccination because there are still a lot of those that are not vaccinated. And if they want to be going back to normal life, then having that vaccine will give them one step ahead of the virus.
Now, easing COVID-19 restrictions does not mean we have to relax. We have to stay vigilant and not let our guards down. So it is important to stay informed and follow health and safety protocols so that you can keep yourself and your family safe from COVID-19. Thank you to infectious disease specialist Dr. Ronchi Solante and clinical genomics lab head Dr. Mark Edsel Ayas for being with us today and sharing your up-to-date information as well as your insights. I'm Dr. Freddy Gomez, and thank you for watching MedTalk Health Talk. We'll see you again next time.